Hey David, how's it going?
Hey,
Thanks
Joe.
for volunteering for me here. Basically, I'm going to be in the function of a nurse, and I'm going to give you a full head-to-toe physical assessment, okay? He's my really good friend, so this is going to be fine. So David, immediately when I'm looking at him, I don't see any issues with him. He looks normal, his mood is normal, his temperament looks fine. This is David I know. So from that point of view, I have an upper hand because a lot of patients, I don't know what their normal mood is. But with David, I do, and he looks fine. David, if you don't mind, I'm going to inspect your skin initially. So if you take your shirt off and lay back, and we can start this process. Okay, so just looking at, I'll put it right here. So looking at David right now, his skin is white. It's red in certain areas because that's the way his skin color is. It looks normal. He has good hair growth. It's on both sides of the body, which shows that there's not one. If there's more hair on one side than the other, then that'll be an issue. His legs, his feet, there's hair growth. I feel like it looks normal to me as I see him. There's no wounds. There's no pressing issue I have to address right now of bleeding or anything that might be pressing. So I'm going to start with the head, and I'm going to bring this assessment all the way down. So we're going to kind of do numerous body systems at once, but it's going to be with his anatomy. So let's start with the hair. I'm looking at his hair. I'm looking for any bumps, any scabs, anything that might be an issue that he may have had that he hasn't told me about. And right now, I don't see anything. His hair looks fine. It looks like he's been in good hygiene. He's taking care of himself. He's properly treating himself. Okay, so now I'm gonna look at your head. So I'm gonna check your temporal pulse right now. So I'm just feeling his pulse. Strong bounding pulse. That's good. We're gonna look at your sinuses too. So I'm gonna kind of feel your sinuses here and under your cheek here. I'm looking for any pain, any filling, any congestion. When he's breathing through his nose, is there congestion? I don't hear anything. He doesn't seem sick to me at all. Let's check his lymph nodes as well. So I'm feeling his lymph nodes. Okay, there's no bumps. There's nothing. There's no induration. Do you have any pain when I push on your lymph nodes? No. And then right here, I don't feel any bumps or anything with that. Okay. So we're looking at that. I'm gonna assess his eyes now. I'm gonna look at his conjunctiva. I'm gonna assess his cranial nerves. There's about 3 or 4 cranial nerves involved with just eye movement. You have the optic, the oculomotor, the trochlear nerve, and maybe another one that I have to think of during this assessment. So first, I'm looking at his eyes initially. I'm looking at the sclera of the eyes. I'm making sure they're white, because any discoloration to sclera can be an issue. So we're looking at his eyes here. I'm pulling his eyes down for his conjunctiva. They're bright red conjunctiva, so that's normal. That's fine. You also wear contacts, right? Mm-hmm. So I understand that he has contacts in that I don't think influences my assessment at all. So now I wasn't able to get a pen light. So what I'm gonna do now is I'm gonna use my finger, and I'm gonna just check his extraocular motions, and I could use a phone as kind of a flashlight to check his pupil dilation. Okay. So initially I'm using my finger. So if you want to follow, actually I have a pen here. I got a pen. I want to use a pen. If you want to follow this pen's tip here at the end, just don't move your head and follow your eyes. So I'm checking assessing those different cranial nerves I said above, down and then towards you. Okay, so that's his EOM, his extraocular movements, and I'm gonna check his peripheral vision now. So I'm gonna come in like this. David, tell me when you can see my hands, okay? On both eyes.
Yes.
Can you see on your right and your left?
Yes.
Okay, so his peripheral vision is intact. It's very important. Now I'm gonna do an ophthalmoscopic exam, and basically I don't have the instrumentation here at the house, but what that is I'm using about 6 inches from his eye. I'm using a light that projects into his eye, and I'm looking for microaneurysms. I'm looking for any bleeding. I'm looking at the blood vessels that supply his eye. So basically, if he had his eyes straight, I'd look into it, and I would see his fovea, his macula. I would see the structure of his eye, and I'd be like, okay, his eye's normal, or within normal range. There's no bleeding. There's no issues there. So I inspected his eyes. His trigeminal. Can you smile at me? Okay, he can smile. Can you grin? Can you open your mouth and bite down? Okay, right there, I'm checking his trigeminal nerve. That's a very important nerve. I can also check his vagus nerve and his vagus, his And there's another one with gag reflex. I'm not going to do that because he won't like me anymore if I checked his gag reflex. Okay, so I'm not going to do that. Also, David, if you could, I'm going to move this pillow up from under your head. Can you put your head down here? You put your down. Can you shrug your shoulders up? Okay, that checks his spinal accessory nerve. So that's good. That's intact. It's strong. He moved it fine. We're looking in his. Now I'm going to check his hearing since I'm in this vicinity. David, can you hear me ruffle my fingers near your ear?
Yeah.
Okay, can you hear me here?
Mm-hmm.
Okay, so obviously I know you can hear my gross sounds, my sounds that are loud. I'm going to whisper a word to both your ears, and you tell me if you can hear it, okay?
All right. Cat.
Okay, you got cat, and then another one. I'm going to kind of reach over here and just kind of whisper another word to him.
Dog.
Okay, so he heard, so his ears are working, his vestibular cochlear is working. I also, if I had an instrumentation, I would get an otoscope. Now the otoscope would look into his incus, his three inner, I would see his tympanic membrane, and I'd look at his three bones in his ear. I'd look at any redness. I mean, we can see if he's dealing with any ear infection. I mean, any ear infection, or any infection just in general, fluid buildup, anything. So I'd grab his ear at the lobe, pull, or actually I'd grab it here at the top here, pull up and back, and that would kind of straighten out his external auditory canal, and that's where I can expect those structures. So I've checked his ears, his eyes, his sinuses, his lymph nodes. David, can you open your mouth? Bless you. Can you open up your mouth and stick your tongue up and down just to look around? Okay, so I'm looking at his tongue. I'm in his mouth, his inner mouth. I'm looking for any bumps. I'm looking for, thank you, David. I'm looking for any redness. I'm looking for thrush. I'm looking for any abnormality besides a pink-red color that lines his mouth. I'm also looking at his teeth. I'm checking hygiene. I'm checking, has he been taking care of himself? Is he having issues? I mean, bless you. If possible, I mean, there could be factors of it basically leading to, you know, I could see probably possible drug use or anything else with his mouth. His mouth can say a lot. Okay, so now I'm gonna go down to his thyroid now. I'm just gonna kind of assess your thyroid here. His thyroid here is in the midline of his trachea, and this is his trachea as well. And then the Adam's apple is the thyroid. So I'm saying it's placed well. David, can you swallow? Okay, he swallowed. I felt his thyroid move, his trachea move. He has a good swallowing mechanism. So that's good, and that also shows the vagus nerve is intact. From there, I'm gonna move down now into his respiratory system. So now first I'm just looking at his chest here. I'm a respiratory and cardiovascular. We'll do this kind of at the same time. So I'm looking at his chest. I'm seeing, and during the assessment, I'm seeing that his chest has been moving up and down. I'm seeing good perfusion. I'm breathing, I should say. I'm also seeing that he, let me put the pillow on your head, sorry. Oh. And then he's volunteering. The least I can do is make him comfortable. So I'm also seeing that he's not struggling to breathe. I don't hear any external wheezing. I don't hear any type of screeching noise that could possibly be an asthma issue or anything. So I'm right off the top of the bat, I'm thinking his respiratory system's in pretty good shape. But I'm going to do further inspection. I'm going to listen to his breath sounds from the front side, and I'll move to the back side. So let's start here right now. David, can you give me a couple of deep breaths as I just move along? You just keep going in and out with your mouth. Okay, I'm hearing nice flow. Okay. Nice flow through this body. One more. Okay, nice strong vestibular sounds. I'm going to move to his back now, and I'm going to check his respirations from his back. Okay, David, do you mind just turning this way, actually towards the wall here?
This way?
The other way. The other way is fine.
This way.
Yeah, I want to show them where I'm placing them. So I'm just going to ask them to do a couple more deep breaths, because the back, if I may say one thing, the back is I will get more of the third. I believe it's the right lung that has. Yeah, the right lung has 3 lobes, and I'll get more of the deeper sounds that possibly could be evading me in the front. So we're just going to start in the back. David, can you give me a deep breath? I'll make you do like 4 deep breaths, okay? Just so it doesn't get lightheaded. So nice, strong, I can hear the air. Okay, 2 more, okay? Okay, this is a deep one, okay? Okay, nice strong, okay, you're good. Nice strong breaths. And while I'm here in his back, I'm going to look at his spine so I don't have to keep making him move back and forth. I'm looking at his spine here. I'm inspecting his spine. And it looks like it's midline to his body. There's no swerving. David, do you feel me touching your back here? Mm-hmm. Okay, he has complete sensation in his back. There's no redness, there's no bumps, there's no pain, and the spine feels supported, it feels strong. So that's good. And also while I'm here, there's... Well, we'll move on to that later here. David, you want to move back on your back here? Okay. Thank you. So his breath sounds were clear. His skin's intact. There's no issues with his spine. I'm gonna now check his tactile fremitus. And I forgot something on your back. I forgot to check your excursion. So we'll do that in a second. We'll get to sit up for that one.
Okay.
So let's check his tactile fremitus. And basically what I'm doing is he's gonna repeat 99, and I'm gonna put my hand on his chest and just feel for any vibrations, any abnormalities. Okay. So Dave, can you say 99?
99, 99, 99, 99, 99, 99.
Okay, so I'm assessing for any vibrations, which I didn't really feel any. So that's a good thing. Tactile fremitus can be an issue. So from there, okay, so his, I've checked his lungs. Now I'm going to go on to his heart, since we're in that thoracic area. And his heart and his neck as well. I'm looking at the first thing I'm doing is looking at his neck. David, can you, I'm going to just talk for 1 second. Can you lay your head back?
Okay.
And I'm looking at his neck. There's no gross arteries that are projecting out. So that's good. There's no possible heart failure where the blood vessels are getting larger. There's nothing I see abnormal there. So now I'm going to listen to his heart. I'm going to listen to his 4 heart sounds here. His aortic, his pulmonic, his tricuspid, and his apical, which is the point of maximal impulse, the PMI. So what I'm going to do first, I'm initially check his second intercostal space in the midclavicular line. Is his pulmonic, and then his aortic's on the left side. Eye irritation.
It's bad.
Coming from the context, but
yeah.
Anyways, we'll just progress forward. I'm gonna check his intercostal space, 5th intercostal space, his apical, and also on his sternal border here is another pulse there. So we'll start there. Just listening for S1, S2. Okay, his tricuspid. Nice strong S1, S2, and his apical. Okay. So initially I'm hearing an S1 and S2. I can use the bell, and I will just show that. I switched it to the bell, which is the smaller one, and what I can hear with that is an S3 or S4, and those are basically abnormalities. So I'm listening here. Oops, excuse me. And I'm hearing S1, S2. I'm hearing a normal heart rate. There's no abnormalities that I noticed off the top of my head. I'm going to also check him on his left decubitus side. Basically, what that is when he's on the left side, his heart will tend to lean forward, and I can hear his apical pulse even stronger. So, David, could you turn this way and point your face that way? And I'm listening to your heart. So basically what I'm doing is, this is the left lateral decubitus. That's right, decubitus. So I'm listening to this apical pulse in this 5th intercostal space. And yeah, I hear it very well, the S1, S2 beating really well. If you want to see, I got it right under basically his left nipple there, and his apical pulse there. It's really strong. So that's good. David, you can go on your back. Actually, David, can you stay on that side all the time?
Oh, yeah.
There's one thing I forgot about the respiratory. I just thought about it. It's the respiratory excursion. So I'm going to just... Actually, David, can you sit up? I'm sorry. Could you sit up and put your back towards Imani?
Okay.
So what this is here is... You're leaning forward. I'm gonna basically, actually, lean more towards me. Sorry.
Okay.
Like this way. There. So if you want to put your right, okay. So David, if you can breathe in and breathe out. So you see how my thumbs are moving. One more time. Thumbs are moving. This shows the respiratory motions basically. And as you can see, his back is intact. The skin is normal. There's no abnormalities. His spine is straight. There's no kyphosis or scoliosis or lordosis, anything like that. So it looks good. David, you want to lay back on sorry, I'm ordering you around.
Okay.
I owe him after this long assessment. So now I'm gonna assess his abdomen now. And actually, I just remembered something. I need to assess his axillary area. His basically, I'm gonna just say this because the report sheet said that we can just talk it out. The breast area and the auxiliary. Basically, I would assess his breasts here. I would feel for any bumps, lumps, any issues, any painness, any tenderness, any warmth in his auxiliary area and his breast. And obviously, I won't do that to him because we're trying to keep it classy here. Okay, so now we're listening to his abdomen. So his abdomen here, I'm gonna listen for any gurgling, anything that shows that his peristalsis is intact, is working. So we're gonna start here, and I inspected it first. I don't see any. It's all intact, normal. I'm starting this right lower quadrant. Okay, I hear bowel movements there. I'm hearing gurgling there. Okay. Okay, I'm hearing gurgling in all 4 quadrants, which is very important, really good. And I'm just going to palpate. I'm going to push down soft. David, do you have any pain when I push on your abdomen?
No.
Okay, there's no pain. The sounds are there. He has peristalsis. These are normal findings. Now I'm going to do the McBurney's point, which I'm actually the first time assessing this. And I'm not exactly sure how it's all done, but I understand, though, that you start at the umbilicus and you go down to this artery here at this waist side. About halfway through here is where the appendix is, and this is a sign of appendicitis. So if I push it around this area, Dave, do you have any pain?
No.
Okay, so there's no pain there. So that shows that that could be a reason to rule out any appendicitis. If he had abdominal pain, I'd rule out appendicitis, which is deadly. I'm also going to listen also to his renal arteries. And his renal arteries here, I know his arteries are retroperitoneal, and I know they're in the back, although I haven't found any thorough assessments of how to listen to that. But we can, David, can you go to your back again?
Yes.
I believe, you know what, you can go back on your back there.
Oh.
The renal, I'm just going to say this, I don't know how to listen to the renal arteries. I'm not sure exactly where to put the stethoscope for that one, but I know that that's something I have to work on and improve in the future, in the renal arteries. We're also going to assess his spleen and his liver. His liver is the largest organ in his abdomen, and it's the right upper quadrant. It takes up mainly like my whole hand here. So I'm going to just feel here for any under his rib cage here, for any enlarged tissue, any hardness, any induration, anything that might be concerning. From there, I want to assess his spleen, and I watched the video of this assessment, and what they said is they start at the right lower quadrant and then move up, and the patient breathes in and out, and the spleen should rub up against your hand if there's an abnormality. You really shouldn't be able to feel the spleen. So David, could you go a couple of deep breaths in and out? Again. Again. Okay, one more. Thank you. Okay, I didn't feel any rubbing on my hand of the spleen. And splenomegaly can be very dangerous. It's perfused with a lot of blood vessels, so that is concerning if that were to be an issue. Okay, so I've inspected his abdomen. I've inspected his heart, his gurgling basically in the stomach. I've looked at his whole thorax basically and his breast sounds, and I've looked at all those things. Now I'm moving on down to his legs. I'm assessing for edema in his legs, which obviously there's no edema. I would see mainly edema pools in the lower extremities. I'd look here for any edema. I'd push down There's obviously no edema anywhere in his feet. His feet are normal. They have hair. Both hair is growing on both sides, which is a very healthy thing. Okay, I can. From here, I'm gonna look at his knees. David, can you bend your knees up? Okay. Can you move your legs up and down? Okay. So that just shows he has motion in his legs. He can actively move his legs. That's a good thing. I'm gonna be also just palpating.
Legs again.
Let's do your legs one more time. Can you move your legs one more time? Okay. Good. Okay, so that just shows he has motion in his legs. I'm gonna check his pedal pulses here. I've checked his carotid. I've checked his temporal. We're gonna check his feet now. They're normal. Can you move your feet up towards you? Can you move your feet down towards you? Okay. And can you feel me touch your feet? Mm-hmm. So he has sensation. He has motor movement. Can you roll your ankle in a circle? This shows his joints are intact. They're functioning. There's no issues there. He has growth in his nails. I don't see any issues with his nails. I see hair growth. That's good cardiovascular health on both sides. His pedal pulses are strong. They're aware. What I'm going to do now, David, is I'm going to check your Babinski reflex. Now, what the Babinski reflex is, it's a neurological reflex, and it shows basically it shows any issues with the spine and things. And I believe it's a upper motor neuron issue, or it could be a lower motor neuron. I believe it's upper motor neuron. So Dave, I can lift your leg up here. Basically, as I move up his leg, I'm gonna use my hand. I know you're supposed to use like a type of stick or something. If I move up his head and I go up this way on the left side and move to the right, if he had a positive Babinski, his toes would flare and his big toe would kind of erect, adduct. So that would show signs. So if I move up now, there's no action going on with that. As I go up, make kind of an L here. There's no motion there. So that's good. Okay. So I've inspected his legs. I've inspected for edema. I've inspected his pulses in his feet. I could do the popliteal pulse, but I understand that if there's a pedal pulse, he probably has a popliteal pulse. That's just my understanding. I've checked his. I've assessed his lower extremities, cardiac health for growth in the hair and the skin. Okay, so from here David, we're gonna check more of your coordination, your cerebellar function. Okay, so if you want to sit up here, actually at the end of the bed here, that'd be fine. Thanks. So if you have your arms like this, could you go to your nose? Okay, so this is showing basically his coordination, his cerebellar function. Also, can you reach your arms up? Okay, so I'm also seeing, not only am I seeing cerebellar function, you can put him down now, but I'm also seeing his muscular strength. He has strength. His joints work in his shoulder. There's not complaining of any pain of any sort. We're also gonna, can you stand up and stay on one foot? Okay, so this is also showing coordination and balance, and on the other foot too. Perfect. Okay, you can sit down again. From there, I want to check his stereognosis. David, can you close your eyes? This is the important function with neurologically speaking, because if they can't figure out what's in their hand, there's something wrong there. Basically, David, if your eyes are closed, let me see your hand here. I'm going to put an object in your hand. You tell me what it is.
Pen.
It's a pen. Okay, so that's showing that he is intact in that sense. I also assess his vibration, or and I can assess his vibration, his stereognosis, and his sensory. Basically, just checking to make sure that his nerves are intact, and they are. He did that on both sides. From here, let me see. I've assessed his spine, his cranial nerves. I've assessed his whole body. Just taking a second to think here to make sure that I've hit everything that needs to be hit. I did a Babinski reflex. Meningeal irritation is something that I haven't assessed yet. David, if you want to lay back for a second, one more time.
Okay.
Okay, the meningeal irritation, my understanding is basically, meningitis causes irritation. If I put your head up like this, does this hurt your neck at all?
Mm-mm.
Have you had any neck pain? You can put your head back down. Have you had any neck pain today?
No.
Okay. With the meningeal irritation, essentially they might have neck pain, or they might have a positive Keurig sign. And to my understanding, I was watching videos on this, was that as I go up on the leg here, and I bend your leg here, okay, I'm gonna start straightening it up, and you tell me if you have any pain. Basically, as I straighten his leg up like this, if I have any resistance or straining like this, that could be a Keurig sign or a meningeal irritation, and they might need to assess further for meningitis, which is obviously deadly. Yeah, so I've done the head to toe assessment. I've inspected everything that I can think of. Is there anything else that I'm missing?
Spread my arm.
I've assessed, yeah, and I've assessed his arm. I can also check his radial pulse here on both sides, making sure it's equal. And overall, I'm looking for hair growth and things to be normal on both sides. And that looks normal. And his skin is warm, and he feels good, and he appears normal to me because he's my friend. So, all right, David, thank you so much.
You're welcome, man.
Thank you.